ME/CSF, one of the things we focused on is reactivation of the herpes viruses, specifically Epstein-Barr. Epstein-Barr, we know it lives in the system. How do we know it lives in the system? Because you get, not Epstein-Barr specifically, but the herpes viruses as the family, you get chickenpox when you're little. And then you get shingles when you're older. The only thing shingles is a chickenpox virus that was living in the dorsal root ganglion of the nerve and crawls out under the right circumstances and then erupts on your skin, causing pain and nerve damage. So we know that viruses can persist in the body in a quiescent stage and then get reactivated at times, and that may be setting off the immune system. So with ME/CSF, we look at specifically Epstein-Barr, and indeed we see what we believe is reactivation of Epstein-Barr in a number of these patients. It is still a challenge as to how you diagnose reactivation of Epstein-Barr and what you look for. And there's arguments to that. We look specifically for reactivation of the IgG early antigen, specifically that one, because there are several others. And we believe that suggests that there's a reactivation in the system. There are others who say you need PCR testing to prove that the bug is active, but it gets into very technical arguments. And unfortunately, the patients get lost in them because there's a point at which you go, let's see if we treat this if you get better. So, and CMV can do it, and toxoplasmosis can do it. Influenza can have set off the problem. So there's a lot of different bugs that can be the problem. And there's also the possibility that you missed the diagnosis altogether, that the patient had Lyme. And we certainly see a large number, we're in the Northeast, we certainly see a large number of our patients where there was a failure to diagnose Lyme disease in these patients because the wrong test was done. And Lyme can be a challenging bug to diagnose. So you've got to start trying to understand if you can identify the bug that's active, is it replicating, and then kill it. You got to go kill it. If you've got active Lyme in your system, treating the symptoms and treating neuroinflammation without treating, and in fact, we know very bad suppressing the immune system in a case where you've got an active Lyme infection, very bad idea. So you need to make sure that in fact that Lyme or other tick-borne diseases such as Bartonella or Ehrlichia anaplasma, those things you have to look for. So you've got to be very thorough in looking for what's going on and see if you've got active bug and whether or not, or if you can't prove that, then the suggestion is you have inactive bug sitting there still aggravating the system. Strep can persist in the tonsils for God knows how long, and can be an ongoing problem with people having what we call these pans pandas symptoms, except the problem I have with pans pandas is the P, which is pediatric. I see these same problems occurring in my adults.
Yeah. Well, that's, gave people a good introduction to this conundrum that hopefully, that's again, one of the gifts of COVID is, and long COVID is that there's more and more work being done to help define, is it just a particle, or are there actually places in the body where the virus can hide in a fairly dormant state?